So I'll quickly rush into some of the programs and projects we are working on. First of all, it's the WHO World Bank Group and ECSA region nursing workforce report that is being developed for the year 2020. And this report basically is about getting to know how many nurses we have in this country, both in the workforce, both in the training institutions, the cost of nursing education. And what I want us to get to understand, and when you're called upon to probably be able to cooperate and give this data, is we want to use this data for advocacy, so that when we talk about bringing nurses to the policy table, we also come with data. So our policy and advocacy is data driven. And if you think about it, we were doing a quick snapshot and we realized that in Kenya, 10,000 registered nurses are not in the workforce. What can you do with the 10,000 nurses? We can come and innovate and develop something like a hub and spoke model, where nurses actually run their own healthcare facilities, so they employ themselves, and they even now provide the primary healthcare services we're talking about. So that's a kind of data we are working towards producing, and I'm proud to say that ECSACON is part of the quad that is developing the nursing workforce report. Okay, let me quickly rush to the three critical documents that Mr. Obengo has been talking about in all the forums. That is the nursing and midwifery policy, and I will not belabor much, but already a consultant through the support of UNFPA has been brought on board, and there's a team that is being constituted through the Ministry of Health as a technical working group to work with the consultant to develop a policy for nursing and midwifery in Kenya, because I think we've operated for a very long time without a policy, and I believe these are some of the critical documents that sometimes probably are not able to, they don't give nurses that leeway. So I think the future is bright for nurses. I think I would say that, and this is a very proud moment to be a nurse. The second one is the scheme of service. The one that was done was in 2014, and already, so one of the justification is already the time has lapsed for reviewing a scheme. SRC has come up with new designation. So I'm proud to stand here and say that there's a partner who has committed to support the process, and we are hoping in the next few days this process will kickstart and deliver to nurses critical documents. And this scheme of service will not only work for the public sector, we also want the private sector to use this as a reference document, so that now when we talk about nurses working in the private sector, they are also equally remunerated. So we want to call upon each and every nurse to become an advocate of the other nurse. The third document is the scope of practice. And Christine, I think what you talked about, the task shifting, I think these are some of the things that should inform a scope of practice review for nurses, a comprehensive scope of practice. So I think when such documents are delivered, I think the kind of research that you're doing needs to inform a scope of practice, so that can we move from task shifting to actually legalizing the work that nurses do. Yes, there's a midwife who's talking about what is the impact of a midwife who monitors a mother and still does the cesarean section. What are the outcomes? So these are the things. Don't task shift and you don't legalize a nurse or a midwife to do. So let's move from presentations to actually putting these results on pen and paper. Lastly, Rashid will belabor on the nursing challenge, the Nightingale challenge, sorry. But I want to say that as a profession, as NNAK, we have enlisted as one of the partners to support young nurses. And I want to laud Macau and Kate yesterday, the ones who did a presentation. And I have to say that we need to really support the young nurses, especially developing a nurse who's a researcher, who's a practitioner, and who's an educator, so that in future, all of us, when we live here, we are also going back to practice, we are also researchers, and we are also educators and advocates. So I'm proud to say that currently we have one of our young nurses in Washington, D.C., attending an International Young Leaders Assembly. And one of the reasons why we wanted her to go, she was nominated, is to be able to also interact with other leaders who are not nurses, young politicians, young advocates, young engineers, so that we can also develop an all-rounded nurse. So again, that's another update on the Nursing Now campaign. And next year, which has been declared the year of the nurse and the midwife, we really want to call upon all of us to come up with anything that we can develop that will make that year a remarkable year for our profession, and for us to not always say we need to be brought to the table, but actually come to the table. I don't want to belabor that. I think I will stop there and thank everyone for listening, and